With over 80 different Medicare Advantage plans available in some counties and advertisements promising everything from gym memberships to debit spending cards, it's no wonder that you can feel like you're drowning in information when it comes to trying to learn about your Medicare Advantage options.
There's too much data.
I'm Cameron Giardini from Giardini Medicare, and my family and I operate our independent Medicare-focused insurance agency where we have helped thousands of Medicare beneficiaries cut through the confusion to understand their coverage options. And truly, Medicare Advantage is one of those topics where people either love it or they hate it.
I hate it.
There is rarely a middle ground. Today, I'm going to give you the no-nonsense complete approach to Medicare Advantage 101 so you can understand what this coverage is all about. Before we start, real quick, I want to invite you to scan the QR code that you can see here on the screen, or please click the link in the description below. This will let you access our Medicare resource website. There you will find all of the Medicare content that we have spent years making, and even better, you can get all of this information without giving us any of your personal details, unlike you'll find on most Medicare websites. By the end of today's video, you will understand exactly what Medicare Advantage plans are, how they actually work in the real world, what they will cost you, and you will also learn their true pros and cons. We will keep this as practical and straightforward as possible. All right, let's start with the fundamentals, because we've seen way too many people get confused right out of the gate. As you get close to age 65, or when you first start thinking about Medicare, you will start noticing something interesting. Medicare Advantage plans are basically everywhere in the advertising world, while Medigap plans are barely ever mentioned. Ever wonder why that is? Well, we will talk about it in a minute. You need to know Medicare Advantage, which is often referred to as Part C, it is actually an alternative way to get your Medicare benefits. Instead of getting your coverage directly from the federal government through Original Medicare, which is Part A and Part B, you can instead choose to get your coverage through a private insurance company that contracts with Original Medicare and the federal government. Here's what trips people up. Medicare Advantage, it is not something you buy in addition to Original Medicare. It is not like buying a Medicare supplement. It completely replaces how you get your Medicare benefits. When you join a Medicare Advantage plan, the government is basically saying, okay, we're going to pay this insurance company a fixed monthly amount to take care of you and your healthcare cost instead of us being the ones to do it directly. Most Medicare Advantage plans are what we call MAPD plans. This simply means that they bundle your hospital coverage, medical coverage, and usually prescription drug coverage all into one plan. An additional thing to know, which sounds great in theory, is that federal law requires Medicare Advantage plans to cover everything that Original Medicare does. There is an exception typically with hospice care in this situation, which is still covered by Original Medicare, even if you're enrolled in a Medicare Advantage plan. But for the most part, again, if Medicare covers something, your Medicare Advantage plan by law also has to cover it. Sounds straightforward, right? Well, here's where it gets interesting. While Medicare Advantage does by law have to cover the same services as Original Medicare, how you actually access this care can be totally different. This is where the concept of managed care comes into play. And it is very likely the biggest difference when you're comparing how Medicare Advantage plans work compared to Original Medicare. First, we've got provider networks. Most Medicare Advantage plans, they work like employer insurance or individual health insurance you have probably had before Medicare. You have a network of doctors, hospitals, durable medical equipment suppliers, and more, and going outside of that network can cost you more money out of pocket, or you simply might not have coverage at all. Now, if we contrast this with Original Medicare and Medicare supplement coverage, then you can see any provider in the nation who accepts Original Medicare. Secondly, when it comes to managed care, there is what is called utilization management. However, you are probably more familiar with the infamous title of prior authorization. This is where you need approval before certain services will be covered, and it is a topic we will discuss in more detail shortly in the video. Lastly, depending on your specific Medicare Advantage plan, you may be required to get referrals from your primary care physician to see a specialist within the plan's network. Again, all of these factors come from Medicare Advantage being a managed care system. To qualify in the first place for Medicare Advantage plans, you do need to be signed up for Part A and Part B of Original Medicare. You have to live in the plan service area and be a U.S. citizen or legally present in the U.S. This idea of a service area is important because it is likely a new concept you may not have heard of. Think of this as the geographic region where a specific plan is available. It could be a county, several counties, or it could be the entire state you live in. You can see some real examples of service areas here on the screen just to get a better idea. Here's what's wild about service areas. People living just a few counties apart can have completely different plan options due to these different service areas. Cities almost always have more choices than rural areas. For example, if you live in Dallas County, Texas, in 2025, you have about 54 different Medicare Advantage plans to choose from. But if you live just east in Kaufman County, you're down to about 30 different plan options. Although that still sounds like a lot, that is almost half the choice for just living a short drive away. This also explains why rural areas tend to have smaller percentages of people enrolled in Medicare Advantage plans compared to their urban counterparts. There are simply fewer options available and often fewer in-network healthcare systems to choose from. As we have alluded to, there are also different types of Medicare Advantage plans to choose from. So let's break down the main types of Medicare Advantage plans you will actually encounter. First, we have the infamous health maintenance organizations, which you probably know as HMOs. These are usually the most restrictive type of plan, but they do often come with lower out-of-pocket costs than other Medicare Advantage plans. With an HMO, you are basically agreeing to stay within the plan's network of providers for everything outside of emergency or urgent situations, including when you are traveling. Most HMOs make you pick a primary care doctor who becomes your gatekeeper. We think of them like this because they are the ones responsible for managing your care and possibly giving you referrals if you need to see specialists. It's like having a traffic cop directing where you can and cannot go for your healthcare. Again, the trade-off is often you get lower monthly premiums and lower out-of-pocket costs with the HMO because you're giving up flexibility when it comes to networks. However, despite what some people will tell you, not all HMO plans require referrals to see in-network specialists. So make sure you check your plan's specific documents to see what they require. Whenever possible, when it comes to Medicare Advantage plans, you will want to look at two different documents. One is called the Summary of Benefits, and the other is the Evidence of Coverage. These documents, they will tell you just about everything you need to know about a specific Medicare Advantage plan's coverage and can often be found on the insurance company's website. You can see examples of the evidence of coverage and the summary of benefits right here on the screen. Now, on the other end of the spectrum of Medicare Advantage types, we have preferred provider organizations, much more commonly known as PPOs. These plans are famous for giving you more freedom than HMOs. Now, PPO plans, they absolutely will still have networks, and you will pay less if you stay in network, but typically you can go out of network and still get some type of coverage. Just know that this may come with higher out-of-pocket costs than staying in network, although surprisingly, there are some plans that have the same cost for out-of-network and in-network services with certain PPOs. Here's what people don't realize though. Just because a PPO says you can go out of network, it does not mean that an out-of-network doctor has to see you. Out-of-network doctors, they are not required to accept your insurance or treat you except in emergencies. And please don't take our word for it. Here is an actual plan's evidence of coverage saying exactly that. So don't get confused and think that PPOs are going to give you the same flexibility as a Medicare supplement. They're simply not. Another flexible thing with PPOs is that they usually do not require you to select a specific primary care doctor to get referrals to see specialists. Now, because of this added freedom and network flexibility, just remember that typically you are going to pay higher premiums or higher out-of-pocket costs for PPO plans compared to HMO plans. Also, for either type of plan, for as much as people like to make it seem like this is unheard of and plan networks are a new thing, if you've had employer health insurance before, you've of course probably dealt with HMOs or PPOs, so it is not a completely foreign topic. For some lesser known Medicare Advantage options, we have special needs plans. These are designed for specific groups of people. There are typically three main types of these plans. One is for people who qualify for both Medicare and Medicaid. There are plans for people with chronic conditions like diabetes, heart failure, or more. And there are also plans for people who need a long-term level of care in an institution. There are also other types of Medicare Advantage plans like the private fee-for-service plans and medical savings account plans, but these are becoming less and less common. Although you can see an overview of these plans on the screen, we are going to skip the details of these lesser known plans for the sake of this 101 video, especially since the data shows many of you will enroll in either a PPO or an HMO. Alright, now let's talk about what you're probably most curious about, the money.
Show me the money!
So let's break down exactly what Medicare Advantage plans will actually cost you in 2025. And just know this will probably be similar for 2026. First off, when you enroll in a Medicare Advantage plan, you still have to pay your monthly Part B premium to Medicare. In 2025, that is $185 per month. You have to do this just like everybody else, and remember, this amount can be higher due to your income. Now, some Medicare Advantage plans, they do actually offer reductions to your Part B premium, as you can see here by KFF, but those plans, they are certainly not right for everybody, and we're going to save those for a different video. Here is where the costs for Medicare Advantage get really interesting. According to KFF data that you can see here on the screen, most Medicare Advantage plans have no monthly premiums in addition to what you pay for Part B. And even when we include plans with premiums, the average across the country is about $17 per month. You can even see the state-by-state average premiums for 2025 using the map on the screen. How is this possible though? It's simple. The government pays these insurance companies big money to take care of you. We're talking an average of at least $1,000 per person per month, and it goes way higher for people with extensive health conditions. After this video, definitely check out our recent video about how some insurance companies game this system for even higher payments. The next cost we have to talk about are out-of-pocket costs, and we'll start with deductibles. Unlike with original Medicare that has a $257 Part B deductible and a separate, much larger Part A deductible, Medicare Advantage plans, they can make up their own rules. Many have no medical deductible at all, but every plan is different and there is no standardization like with Medigap plans. So again, make sure you check out the plan documents for your specific plan you're considering. What about copays and coinsurance? Again, this is another big difference from what the standard original Medicare 80-20 split normally looks like. With Medicare Advantage plans, you will typically pay fixed copays. This means a dollar amount instead of a percentage for most cases. This can be something like a set dollar amount to see a specialist instead of the 20% of the cost you would pay with just original Medicare. Again, every plan sets its own amounts. Remember to see specific out-of-pocket costs again for Medicare Advantage plans. The best way to do that is to look at your plan's summary of benefits and evidence of coverage. Or of course, you can use the link below to connect with us or one of our other independent broker partners after you watch this video. When talking about out-of-pocket costs, we also have to mention the maximum out-of-pocket limit, or the MOOP, when it comes to Medicare Advantage. This is actually one of Medicare Advantage's most important features in our opinion. This is a legal cap on how much you can spend on covered medical services in a year if you're enrolled in a Medicare Advantage plan. For 2025, that cap is $9,350 for in-network covered care. However, it's also important to know that with PPO plans, for combined in and out-of-network care, the limit is even higher at $14,000. And lastly, on the screen here, you can see these limits for 2026. Contrast this with original Medicare, which has no out-of-pocket maximum. This means you could theoretically spend unlimited amounts of money. That is, of course, if you don't enroll in a Medigap plan to also go with original Medicare. It's important to also know that these maximum out-of-pocket limits can and will change over time, and you can see here on the screen how they have changed over the recent years. In addition, you should also know that the amount that you spend towards your Medicare Advantage maximum out-of-pocket, it restarts every year back to zero on January 1st. And this maximum out-of-pocket limit applies to the whole calendar year.
What about drugs?
Moving on to prescription medications, most Medicare Advantage plans do include prescription drug coverage, which is pretty convenient. While drug costs do not count towards the medical out-of-pocket limit that we just mentioned, there's good news as of 2025. There is now a $2,000 annual cap on what you'll spend on medications covered by your plan. Just know this cap is going to $2,100 as of 2026. As for prescription deductibles, copayments, and which medications a plan covers, make sure to use our video on the screen here showing how to use Medicare.gov to find this information. Now let's give you the real scoop on some of the restrictions and rules that make Medicare Advantage plans unique, because these potential downsides are what many people worry about most. First, looking at provider networks, here's something that surprises people. Just because two plans are both PPOs does not mean they have the same doctors. In fact, each insurance company builds its own network of providers, and even within the same insurance company, their HMO plans might be different than the networks with their PPO plans, even though they're both Medicare Advantage plans. The sizes of plan networks are also all over the map. Some cover just a few counties in a metro area, while others have nationwide networks of in-network providers. We have seen plenty of HMO plans with surprisingly large networks, while some PPO plans have surprisingly small ones. Perhaps even more importantly, you should know that even when you sign up for a Medicare Advantage plan, although you are signing up for typically the full calendar year, doctors and hospitals, they can drop out of plan networks mid-year. It certainly happens. Always double check that your current doctors are still in network, especially if you're in an HMO plan where going out of network means paying the full bill yourself. What about annual plan changes? This is huge. Medicare Advantage plans, they are 1-year contracts, and they run from January 1st to December 31st. After that, everything can change from year to year. This means premiums, copays, drug coverage, and again, even which doctors they are in network with. This is why we always tell people to shop your coverage every single year during the fall annual election period, or at minimum, make sure you read your annual notice of change letter sent to you by your Medicare Advantage plan before you decide whether to just stick with it or not for the following year. And even more so, as of recently, it's also possible your plan can simply be terminated altogether as we head into the new year. Now, we talked about it earlier in the video, or at least alluded to it, but what about prior authorization? We will keep it simple. Odds are, if you choose Medicare Advantage coverage, prior authorization is going to be part of your life eventually. This is when the insurance company says, wait a second, we need to review and approve this service before we'll actually pay for it.
Do not go anywhere without prior authorization.
According to the most recent KFF data, Medicare Advantage insurers made almost 50 million prior authorization decisions in 2023. Now that works out to about 1.8 requests per enrollee. Before you panic though, only 3.2 million of those were denied. Now this of course sounds like a huge number, but it is about a 6.4% denial rate. And even more importantly, it is not a final denial rate, because when people did appeal those denials, over 80% were overturned. However, just know that a lot of the denials were never even appealed, so who knows what that number would be if they all were. You can see here on your screen which types of services commonly require prior authorization. It is usually not routine stuff like primary care visits, but instead it is likely to be expensive procedures and treatments. How about some good news though? There are some improvements coming in 2026 that should make this process at least a little less frustrating. And truly, if you've had just about any type of health insurance in the past, you've probably dealt with prior authorization before. It's not unique to just Medicare Advantage plans, and you have to understand it is part of the reality of choosing this type of Medicare coverage. So why do people put up with the possible restrictions of Medicare Advantage plans? Beyond just the potentially lower premiums compared to Medigap plans, there are also the famous, or a little bit infamous, extra benefits not covered by original Medicare coverage. Some people say the benefits that are provided by Medicare Advantage are amazing. Others will just call them worthless marketing gimmicks. As usual, the truth is somewhere right in the middle. On the screen, you can see from KFF some of the most common extra benefits offered by Medicare Advantage plans. Also, according to a Commonwealth Fund survey, 89% of Medicare Advantage members say supplemental benefits are important to them. Compare that to 74% of people with traditional Medicare who think these extras are important. We also did our own survey of Medicare Advantage and Medigap members, and you can see on the screen here what Medicare Advantage beneficiaries from our survey think that extra benefits are worth to them financially. Now, this is just their opinions, and we will say this is only about 30 Medicare Advantage respondents, so please take these numbers with a huge grain of salt. We just want to show it because we think it's something unique for you to see from the perspective of your colleagues. And we have to address the elephant in the room.
Oh, me?
Here is how Medicare Advantage plans can afford to offer these extra benefits while keeping premiums low. Remember, the government is directly funding these plans. According to MedPAC, in 2025, Medicare Advantage plans, they receive an average of $2,255 per year per enrollee from the federal government so that they can offer supplemental benefits and other plan enhancements. Also, again, according to MedPAC, in 2025, Medicare Advantage plans are projected to spend $39 billion on non-Medicare covered services. That's about $100 per person per month. The most important thing to remember with Medicare Advantage extra benefits is that benefits vary wildly by plan and location. Those flashy TV commercials and ads you see on Facebook showing all of these amazing benefits, they're probably not talking about the specific plan available where you actually live. Again, only what is actually available in your area is what matters to you. So make sure to work with a trusted independent broker and not a celebrity on TV. When can you actually enroll in Medicare Advantage plans? For most of you watching this, your initial enrollment period is your first shot to enroll in a Medicare Advantage plan. It's a 7-month window, which is 3 months before you turn 65, includes the month you turn 65, and continues for 3 months after the month you turn 65. This does shift 1 month earlier if you were born on the first day of a month. Also, know that if you're under 65 years old and you qualify for Medicare due to disability, your initial enrollment period timeline is a bit different. It generally starts 3 months before your 25th month of getting Social Security disability benefits, includes that 25th month, and continues for 3 months after that 25th month. Keep in mind that these timelines are also different if you're eligible for Medicare due to end-stage renal disease or Lou Gehrig's disease, and we'll just link to those different scenarios in the description. But what if you miss your initial enrollment period or you delay it on purpose? Well, thankfully, there are still many other opportunities for you to enroll in Medicare Advantage coverage beyond when you're first eligible. Since this video is already getting a little too long for a 101 video,
Tell me about it.
make sure to watch our specific Medicare Advantage enrollment period video to learn about your other options. But we do want to leave you with some additional important information about Medicare Advantage enrollments. Unlike with Medigap plans, Medicare Advantage plans, they cannot ask you health questions or turn you down due to pre-existing conditions. There are exceptions for the special needs plans where they may ask you health questions to qualify for a specific condition the plan covers, but that is different from medical underwriting that you see with Medicare supplements. Now that we have covered most of the important topics about Medicare Advantage, let's briefly go over some straight talk about the pros and cons of these plans. Since despite what people might tell you, Medicare Advantage plans simply are not right for everyone. First, the good stuff. Low monthly premiums, and if you're relatively healthy, your total healthcare costs might be lower than original Medicare and Medigap. Everything is bundled together conveniently. Usually these plans include prescription drug coverage, and you also get those extra benefits that we've talked about. And unlike with just original Medicare, there is also that legal limit or maximum out-of-pocket on how much you can spend on cover services each year. Now, the not so good stuff. You're stuck with network restrictions, especially with HMOs. Prior authorization can delay care when you need it, and if you're really sick, you could of course hit that maximum out-of-pocket limit, which means potentially spending thousands of dollars out of pocket each year. Also, everything about your plan can change annually. This means you need to pay attention. In some areas, choosing between dozens of different plans, it can simply be overwhelming. And finally, you may not be able to change to a Medigap plan in the future depending on your health. Now is our recommendation for how to choose a Medicare Advantage plan. And yes, we are of course biased because this is what we do for a living, but you should work with an independent broker who knows the specific plans available in your county. There is a reason we focus on specific areas because every county is different and what works in Dallas might be terrible in Denver. If you want to connect with us or one of our partners in other states we don't work in, please use the link in the description. We don't charge you anything and we are paid by the insurance companies, so our advice is free to you. Or if you're more of the do-it-yourself type, we have a detailed video showing exactly how to research and find specific Medicare Advantage plans on your own. Overall, Medicare Advantage can be fantastic for the right person in the right situation, but it's not a one-size-fits-all solution, despite what those TV commercials might suggest. The key is being honest about your healthcare needs, your budget, and how you truly want to access your medical care. Now, make sure you compare Medicare Advantage to Medigap coverage by watching our Medigap 101 video next.